That she can come all the way from California to speak with you today. So, Assemblywoman Gonzalez.
See if this. Okay, can you hear me?
Yes.
I'm not. I have a loud voice, so sometimes I kind of. This is a strange room as far as how many people. So sometimes I'd go without the mic, but I'll use it. So thank you. I'm so excited to be here. As Allison said, my name is Lorena Gonzalez. I represent, people always say, where's your district in California? And I have to say San Diego. Technically it's San Diego, but it's not postcard San Diego. So I represent the border district. They basically found every poor person in the county, and it's all my district. So in California, we have, I just, to put in perspective, because sometimes people are like, wow, you're really liberal for San Diego. Like, I represent poor people, and I'm proud of that, hard-working, working class folks. And so in California, we have districts that are about 470,000 people per district. So we're just comparing to Pennsylvania, which is slightly, their districts are slightly smaller. And my district is a working class district. Before, I grew up in San Diego County, went to public schools, and nobody in my family had gone to college. My father had immigrated from Mexico. He was a farm worker when he first came over. My mom went to community college and became a nurse. And so I was told I would go to college and didn't really know what that meant, just that I was going to go. Ended up applying and getting in seriously on accident because I didn't know what I was doing to Stanford University, which changed my life. Right? I never stepped foot on a college campus, and I come home and tell my mom I'm going to go to Stanford. She's like, good luck with that. But it changed my life, and then I went on to get a master's degree at Georgetown and a law degree at UCLA. But never forgot where I came from. And so I came back to San Diego, and I worked in labor, organized labor, for quite a few years, was the head of the AFL-CIO in San Diego. And there was a seat opening up in the assembly. And it was always my dream to be an elected official, which is kind of a bad word in labor, like to go from being a union leader to elected official. It's not like you want to go tell people that's your dream. So I made the commitment of a few things. First, and I don't know how organized labor is in different areas, but in San Diego we were running into some problems, some pension issues, so we didn't have necessarily good poll numbers. But I said I was going to run as an organizer that I was going to run as a labor leader. And the reason I assured labor I do that because I said I know what I'm running as. I want to represent that. We knew that of the 120 legislatures in the Assembly and the Senate in California, that only 13 were women with children. 13, right? And yet, over half my district was women with children, right? So we said, there's time that we have a working mother's perspective in the Assembly. I have 2 kids. They're now, my daughter's 20 years old, she's at NYU, and my son is 13. But when I ran, it was 3 years ago, so they were both at home, high school and elementary school. And I said, it's really important to be that close to being a mom. And so when I got elected in a special election, we said, how do we continue this to ensure, how do we make sure that we're doing what we said we would do? And one of the things I do is, I do have this tendency to read studies a lot. I know, like I was on vacation a month after I'd been elected, they had a month break, and I saw this amazing study from Yale about diapers. And it was in 2013 when it came out. And I knew at that moment that this was something I wanted to work on. Because first of all, I came from a working class background and represent working class people. And despite the fact that I was a young mother, I've had kids, I never really thought about the challenges of diapers, right? Until it was put in my face, and then I thought, why, it was just a need. You just do it. You buy diapers, right? And yet I knew the stories of women in my neighborhood that would go to the neighbor's house to see if there were any extra diapers. You just never really thought about the fact that you couldn't purchase them with food stamps or with WIC. I mean, I remembered the M&M song, so I knew, I actually quoted on the assembly floor, you can't buy diapers because so many people don't know that, right? And I knew that they were expensive, and when you look at the CalWORKs grant, which we have in California, our welfare grant, I think about is Jessica still here? $749, I think, is what it is. Well, if you're spending $100 on diapers and rent's high, how are we doing this? How are these women doing this? And it was clear from that study that they were going without. And of course, I don't need to tell this group, the mental health issues that are involved for a mother, the health issues for the child. But as a former labor leader, one of the things that really got me was the barrier to work. In California, to drop your child off at a child care facility, even a subsidized one, you have to provide 8 to 10 diapers. 8 to 10 diapers. So even if you're doing everything right, you've had some need, you're on welfare, but you're trying to get off because, to get subsidized childcare, you have to show that you have a job or that you're in school getting training. You do all that, and you show up, and we actually heard from women who did this. They show up, they're so excited, they finally got into subsidized childcare, which is hard to get into. They show up on their first day, and they didn't realize they had to bring 8 to 10 diapers, and they didn't have them. And that's where, of course, so much of the work that you all do with diaper banks really comes into play. We actually had a woman testify that, thank God for the diaper bank who gave her the diapers so that she could actually, on her second day of work, actually make it to work because she could drop her child off at the child care facility. So to me as a legislator, I started learning, obviously, about the good work that was being done. There isn't a diaper bank in San Diego. There's one in Los Angeles and San Francisco, and I think there's a couple smaller ones, Menlo Park. But there's not that service. So one of the things I did before I introduced a bill, because I realized that's great that some cities have these diaper banks, but it's also not great when you're in a city that doesn't have one. Right? And even in LA, as big as it is and as successful as the LA Diaper Bank is, you know that they can't fulfill the need of every single person, right? And so, I got together with the folks before session started with the folks who do 211. I don't know if it's hard when I'm outside of California, like the service, social service 911. Kind of thing. And I first was asking just is this really that big of a need here? And she goes, it's the number one phone call that they receive is for facilities that give diapers in San Diego County. So they were able to pull the numbers. It is the number one request. And she said, and the heartbreaking thing is there just aren't a lot of agencies that serve it. So she went through them with me, and there were 2 birth line facilities, basically facilities for pro-life facilities in town. That some people were uncomfortable going to. And then there was one social service agency that sometimes would have diapers. And she even told me that when she started doing the work to see which social service agencies provided them, a lot of them say, don't tell them we have diapers. We may have diapers once in a while, and we'll give them to our clients, but if we start advertising we have diapers, we'll have too many people here asking for diapers. So we have that kind of need in San Diego. We ended up doing massive amounts of diaper drives, as you can imagine, over the last 3 years, and using our community health centers as a way to distribute them. I'm happy to say, I can't announce it yet because it'll be announced in early next year, but I did just recently, in fact last week, got the confirmation from a nonprofit who's going to start a diaper bank in San Diego, so that should be coming out. Yeah. But it became so clear to me that no matter how many nonprofits are involved or not involved, no matter how many diaper drives we have, and we have a lot, that wouldn't fulfill the total need, and that it's government's responsibility to truly step in and do more. And so I literally looked everywhere for legislation and contacted, of course, the National Diaper Bank Network, and there was nothing in states that really could provide me a path to create legislation. My staff person is going to present it one of the next things, so I won't go too far into it. But I literally was like, all right, I'll make up a bill. We'll just say we're going to give people money for diapers. We'll make up a program, and that first year, that's what I did. And it was amazing to me. I mean, Legislative Council, it was well written. It just was a little bit of a mess if you actually work with departments. I knew that they didn't know what I was talking about. They kept they were dumbfounded that somebody was writing a bill about providing diapers, basically. But what amazed me is every time I sat in a committee, every time I would present, there were hecklers and there were people who made fun of, you can imagine all the jokes about, her priority is diapers. But there were parents on the panel who you would see the light go off, right? I mean, we're legislators. We're all making over $100,000 a year. But when a young parent goes, oh yeah, how much do I spend on diapers? How do poor people purchase those diapers? Well, of course. And it really was beautiful because it's uncomfortable to talk about, right? It's uncomfortable to say, you know that stigma that you have or that idea that you have about my constituents, that somehow they're dirty out of choice, that you go to the park and you see a little baby in the diaper, you know that diaper needs to be changed, and you're thinking there's something wrong with the parent because the parent's just not changing the diaper. Well, maybe there's something wrong with us because the parent can't afford to change the diaper. And it's a very powerful thing to see that go one by one through the legislature. In that first year, we had like tremendous success. I got through the assembly, got all the way to the Senate, was in appropriations, and the chair of appropriations called me and he goes, I do not want to be the person to kill this bill. He's like, but you and I both know. I said, I know. I didn't know what I was doing, throwing diaper money at people. This $170 million bill. That there's no way the governor was going to sign. It was really like a beautiful idea. And I said, okay. He said, I have to hold it. And he said, but I'm just going to ask you not to put me on blast for holding the diaper bill. And I said, no, I think it's a good idea because it wasn't well thought out because it was just a discussion starter. But the amazing thing is, over the last 2 years when I had 2 diaper bills, one because we still tax diapers in California, we're still trying to get rid of that. The amazing thing is I've been able to secure a co-author who is a conservative Republican on, think about this, on an augmentation for a welfare grant. It has been an amazing experience, and we used and worked with the Catholic Conference. We talked a lot about people's decisions and their views on choice. And if you're not pro-choice, then what's the responsibility of babies who are born? I think it helped. I'm Catholic, so I can speak the language and don't get nervous talking to people. I'm a pro-choice Catholic. They get nervous. Everybody gets nervous. But I can talk to both sides because that's where my district's that way, quite frankly. They understand that there's needs. If we want precious babies born, we have to treat them precious once they're born. So it's been an exciting kind of adventure. Unfortunately, both my bills got all the way through this year and then got vetoed by our governor, which we kind of knew would happen. We have a little stingy governor. I mean, he's great, but he's stingy. He takes a long time to get to where we need to be. But the incredible thing is we also got some language in the budget to force the administration to talk to us. The administration for years just wouldn't talk to us about how you create a new program. And of course, they don't want to create a new program. But this is something we needed their cooperation with to actually do. So they're now forced to work with us because it was the budget language. What I did is I was on the budget conference committee. I chair appropriations in the assembly, so I got to sit on the budget conference committee. And I literally put $15 million in the budget for diapers. That's what it said, $15 million for diapers. Everybody's like, well, where are these diapers going to go? I knew it would blast through the conference committee. I just put it there. And it forced the governor to have a discussion about diapers. Now, they put a working group together. The amazing thing is, and you can imagine, the same questions that I heard immediately when I started this bill in the assembly is what we're hearing from the governor's office now. Why not cloth diapers? And you have to say, well, cloth diapers might be right for some people, but let me tell you about the people who live in my district. They don't have a washer and dryer. They go to a laundromat. You cannot clean cloth diapers in a laundromat. The child care facilities that they visit don't accept cloth diapers. So although it might be a good, reasonable expectation for some families, it's not something you can ask working parents in my district to do. And they say, oh, like they'd never even thought of that yet. Okay, so you get past that discussion. And then they say, well, why can't this just get fixed at the national level? Why can't food stamps be used? Well, you have to go through the entire process of an explanation that at the end of the day, although some municipalities and cities have done very well, like San Francisco has already done in providing this type of relief, it really sits with the state to start making some changes to ensure that there's one less barrier to work for women who are trying to get back on their feet, that our children are actually going to be a little healthier, that the mental health of poor families who already suffer from mental health issues as a result of being poor, that it's not exacerbated because they're around a crying child all the time because the diaper always needs to be changed, right? I mean, these are very basics, and we're hopeful that if we continue this, which we already plan to do, we have a bill ready for next year, that we can actually get to a point where we recognize it takes all of us. It takes the private sector, the nonprofit sector, and all the good work that's been done. We need more diaper banks. We need that availability to fill in the gaps that we're never going to fix just by the state alone. And we need the state to do something. But most importantly, one of the reasons I wanted to come is we need to keep talking about it. It shocked me when I read the article that I hadn't heard. Nobody talks about it. It shocks me that every time I go speak on diaper issues, and at first, it's a little tongue-in-cheek, but people don't think about it until it's brought to them. And I'm not sure why that is, and that's something that I think all of you think about, because this is what you do every day, but it's shocking to me sometimes to go out and try to engage new groups. And almost to the nth degree, those groups get excited, right? I'm really excited today. I do a big diaper drive for my holiday party. And different groups every year have come and they give diapers. Well, this year I had a organizer with our local iron workers union. Now, these are the iron workers union, let me give you an example. They don't care how much time you spent in prison. You got to go up 18 floors on steel. These are guys with tattoos here and almost all male, burly guys. This gentleman, this organizer, said one day he was watching TV and got upset because he's sick of hearing about the presidential election because they're not too happy with either candidate and they just got upset. And then he saw on Facebook that my diaper bill got vetoed. And he decided he needed to do something positive. So as we speak, and he sends me pictures every day of these men coming into the union hall with 2 big boxes of gloves or Huggies or Pampers, bringing in diapers, because that's a positive thing to do, right? So I'm putting it on Facebook, and now I'm challenging these other, look, if these guys can go and buy diapers. And the great thing, he says, some of them are like, dang, I didn't know they were that expensive, And that's the point, of course, of a good diaper drive, is it also brings around that awareness. So I'm hopeful as we move forward, just bringing in everybody to have this discussion changes lives. And if we can push our elected officials to continue to look at this as a bipartisan issue, an issue that affects families, obviously mental health is a barrier to work, is good for everybody, that we can actually get some movement both in Congress and throughout our different individual states as well, because it will take all of us, as we know. I mean, when you think about 1 in 3 families that suffer from diaper need, how will we get to fulfilling that? If you think about a state like California, granted, we're a huge state where 50% of the kids are being born under Medi-Cal, they're being born under federal, basically, subsidized childcare or healthcare. And 73% of the state qualifies for subsidized care in Obamacare. 73%. So we know it's not just a poor issue, it's a middle class issue, and that kids need this discussion to happen. So I don't know if I'm supposed to take questions.
If you'd like.
I am more than happy to answer any questions if anyone has any. Okay. Yes, ma'am.
We were all wondering what exactly is that program in San Francisco. We were all wondering about which helps supply those diapers. We know somebody had mentioned it, the San Francisco diaper.
So they're going to talk about the panel after.
Okay. Thank you.
I'm trying to push the panel so everybody can. She's like, don't say what I'm going to talk about so that they have to listen to the panel. But it's a, you'll hear about it. She's giving me the eye.
No.
It's okay. And I know other cities are looking at it as well.
I don't know if you're going to address this later, but I'm assuming the bill is now more complicated than 15 million for diapers or whatever.
Oh, it is.
What exactly is
Okay.
the mechanism in the bill to provide diapers?
Thank you. And what we settled on to try to reduce the cost, and it is still $15 million a year, but to reduce the cost and make it work, is we're in the process now of moving our WIC and EBT obviously to cards, and by 2020 everything has to be on the card. I think this is a federal standard. So what we said is it would be a diaper voucher, but not a paper voucher to reduce costs. It would just be a $50 a month amount allotted on that card that would allow you to purchase diapers. So kind of based after the WIC voucher program, but it would go on the card, and if you qualify for subsidized childcare, then along with that qualification, once you get that, you get the $50. It's very limited. It's not enough, right? It was a start. And the reason we did that is, and the reason I'm kind of committed to that idea is it's the idea of a new program that's freaking out our agencies, right? So we're fighting over the new program, and it has to be a smaller cost. So we really honed in on the women who actually have qualified and get subsidized childcare, which there's a huge waiting list for. We need to do more in that. But what we're hopeful is once we get past that program kind of block, that we can expand it to, of course, all the women who are on welfare and then beyond. But you have to start with something. Does that make sense?
Yeah.
I want to go and talk to my state legislators. And what would you suggest is the first way to start that conversation when I'm not sure which option is going to be most attractive to them? And that's what I want. I know I have lots of ideas, but how do you open the door when you're not walking in with a bill already written?
So I would say on this subject in particular, it's introducing the problem, right? Because that's what got me. It was reading, for me it was a study. A lot of people don't like to read studies, but I read articles about the study and then had to go find the study because I was so intrigued in what was happening, but making people think through the problem first. And then realizing the problem with the problem is it's so big, right? If we really stop and think of the millions of women, and I know men too, but like a lot of these are single moms, of course, but the millions of families who suffer from diaper need. And so it's taking that problem and saying, what facet of it are you, and it depends on the legislator, right? So the first year I wanted to do everybody that received CalWORKs, which is our Welfare to Work program. That's huge, and the cost was huge, and that's why the Senate Appropriations Chair is like, okay, you gotta stop. And we never expected to get that far, but we kept pushing it because we were getting media attention on it, and the more media attention we got, the more diapers we got in diaper drives, and the more people engaged on it. That bill only got Democratic support. And I decided, even though in California you can get everything done with just Democratic support, but I know to really tackle this issue long term, that it would mean more to be able to get bipartisan support. So if you live in a Republican state, really, really honing in on one of two facets, right? Either young, I would suggest young teen moms is one that got them for me, but also this barrier to work. We want people to move off of welfare, right? And that's what, I had this discussion with so many Republicans, like we all say that. We all agree. We don't want people to have to rely on state services. And we actually force them to try to move off and do horrible things if they can't, right? But let's all work in the fact that we want them to move off. We provide subsidized childcare. But if there is no way that step, what are we doing as a society? What are we saying? There's barriers to work. So we really emphasize the barriers to work in order, one, because my background coming from labor, it's something I care about, and I think there's dignity in work, and people want to work, and you want to show all the reasons why sometimes these young moms, in particular, don't have an opportunity to enter our workforce. So it was that, but it also provided an opportunity to talk to the Republicans about, I'm being general, of course, but it really did work. My co-author in the Senate, and actually presented the bill in the Senate, is probably the most conservative Trump Republican in California. And he got it. He got it on both the if we're truly pro-life and the fact that, you know, we should help people work. And so I would suggest, you know, so your legislator, if they're Democrat or Republican, you know, my side tends to be like, oh yeah, it's a great, I mean, my first year, people are like, that's just a great way to give people more money when they're on welfare, which they need more, so that's great, you know. We can do it that way. And then when we got more specific, though, we were able to get different people on.
Thank you, Assemblywoman Gonzalez.